So if you have a parent, and I think that a big part of this is not everyone could have a pediatrician like you, and not everyone, has access, and they end up with a pediatrician that is probably stoking some fear and saying you have to put a child on this antibiotic. They have strep throat, let's say. And so you want to put a child directly on that antibiotic. And as a fearful parent, thinking you're doing the best for your child and, alleviating suffering and bringing them back to a state of health, you go along with it. So, what would your advice be for a parent that's changing that attitude? Okay, my child's not a petri dish environment we should look at, but my doctor is still telling me, as my child is sick right now, that I need to go on an antibiotic. What would be your advice there?
So the first thing that I try to educate parents on is what is the end game of the body? They look at me. I say, well, if the body could tell you what its purpose is, what would it tell you? And there's silence because, they've never asked this question. And so I say, if the body could talk, it would tell you, my job is to get rid of as many wastes, toxins, impurities, and inflammation as quickly and as often as possible. And so there's this stunned look, of course. And then I say, okay, so let's ask these questions. Why does the body exhale? No answer. Why does the body urinate? Why does the body have a bowel movement? Why does the body sweat or smell? Why does the body rest or sleep? And the sixth thing, why does the body produce mucus? So here we have the lung system, the intestinal system, the kidney system, the intestinal system, the skin system, the nervous system, and the immune system. Why are those six systems doing what they're doing? And the answer is to rid the body of waste, toxins, impurities, and inflammation. And the fact of the matter is, we do it without getting sick. We exhale, we urinate, we stool, we sweat and we smell, we sleep, rest, even exercise, even scream, which is a way of the nervous system to open itself up and clear itself out. And then we produce mucus. So all of this is happening without us consciously recognizing it, other than the fact, well, I need to go to sleep or I need to go to the bathroom. But we don't say, oh, I need to breathe. We just do it. We don't say, oh, I need to sweat. We just do it. Although going into a sauna is definitely an added benefit. So we are getting rid of waste, toxins, impurities, and inflammation all the time. No symptoms. And so where do we get symptoms? Airway. Oh, I guess now we're coughing. So a cough is an exaggeration of an exhale. Mm-hmm. So it's merely the exhalation trying to upregulate its attempt to accumulate, to get rid of whatever accumulation of material has to come out through the lungs. Or we bedwet, or we urinate more, or we have accidents. We might stool more. We might have diarrhea. We might have a rash. We might sleep more. We might be more irritable as a way of that primal scream gone in another direction. Or we might produce more mucus. So essentially, the lung system, the urinary system, the intestinal system, the skin system, the nervous system, and the immune system are all helping us get rid of waste, toxins, impurities, and inflammation. And if we're good at it, we won't feel it. But when the scales are tipped and there's either too much coming in that's irritating or too much sensitivity to what's coming in, or an actual weighing down of the body's ability to eliminate, like constipation, can be a huge setup for the lungs to get sick, right? So the body has to work hard to get rid of those waste and overcome our dietary, environmental, nervous system choices. And so we have to get sick. And that's a twist. That's a mind twist out of the paradigm of, well, everything is an infection, to, well, what's going on here? Now, I think the hardest concept for all parents, everyone to accept, is the fact that they've been lied to about germs. Right? What is one of the main ideas that we're taught that is parroted and sheepified throughout? You don't get sick unless someone is sick with a germ and gives it to you. In other words, you couldn't possibly have the germ until it's going around. And so that's false, because most parents are not aware that we have over 100 trillion bacteria lining our body all the time. And every time you touch something, every time you eat something, every second, every breath you make, every brushing of the teeth, every sexual relations, every wiping of the behind, you're not only exposed, but you're putting it all into the bloodstream. And so the hardest part is teaching parents that there is never a second in your life where you aren't exposed to bacteria. So I know that's a double negative, but you're never not exposed to bacteria. And you're touching people, and you're hugging people, and you're eating off their fork, and you're drinking from their cups, and you're shaking hands, and you're wiping your noses, and you're having relations, and you're never not exposed to bacteria. But only when you're sick do they tell you you're catching a bug from someone else. The other hard part of this is teaching parents why those bacteria are on your body in the first place. Why, from nose to lungs, mouth to anus, all over the skin, and in the women's reproductive system, those bacteria are there in the first place. Because they're there. And there are over 100 trillion of them. And they're always there because we breathe, we eat, and we touch. We're never not exposed, and we're never not colonizing. So why are they there? Well, they're there to help the body stay well. But you're made to believe that you're not going to get any of them until someone's sick and gives them to you, right? So you couldn't possibly have strep in your throat because it would only be there if someone is sick and gave it to you. But it never would be there all along without overgrowing for any reason because you have no symptoms. And that's false, right? And just because you put a swab into the throat and when you're well and go to culture it and no strep grows doesn't mean no strep is in there. It just means you didn't catch it on the swab. So this is hard because the paradigm says, no, you don't have strep in your throat. And if you did and you were not sick, something's wrong. And that's not true either. And so the reason the bacteria are there is because they're responsible for keeping us well. They're there to protect anything that gets on the linings of the body. They're there. They provide a barrier, and they provide continuous immune system regulation and nervous system regulation. There's a constant antenna-like communication between the bacteria and the nervous system and the immune system, and the liver and the lungs and the reproductive systems. Constant. And so they're providing a barrier, they're providing communication, they're providing defense, and they help you get rid of wastes, toxins, impurities, and inflammation.
And isn't that also part of the role of the tonsils?
I'm going to get to that.
I
Yeah.
was going to say, yeah,
Yeah.
that sounds a
Yeah.
lot like, because I know a lot of children have that and parents have that idea of, oh, you have tonsillitis, we need to remove this
Correct.
unnecessary, body part.
So
Never happens.
you came in at the right time because you saw I was building up to.
Sorry.
No,
I had
you
to.
were perfect. I knew that I realized I was making the right story
Yes.
because the bacteria are always there to help us rid ourselves of waste, toxins, impurities, and inflammation. In fact, it's the bacteria that are in the rectum and in the colon that signal the wall of the colon, hey, it's time to evacuate.
Yep.
And that's why people don't understand that the bacteria are playing a vital role in keeping us well, in constant interaction with the immune system and the nervous system. One of the reasons you smell at the end of a day is because the bacteria were helping your body remove the wastes through the skin.
Mm-hmm.
So these microorganisms are doing their job over the linings everywhere. Wherever there's a lining, there are bacteria doing their job. And one of those linings is the nose, the sinuses, the adenoids, the tonsils. And what people and doctors completely forget this, Casper. They forget that the tonsils, the adenoids, and the sinuses are part of the 24 feet of gut-associated lymph tissue, GALT, G-A-L-T. It's part of the entire intestinal system that is responsible for helping to clean the lymph. And for people who are interested in the lymph tissue gets everything in the body that the blood doesn't get. So just a little technical science, when blood goes to the tissues, the material in the blood goes into the cells, but the juncture between the blood vessels and the cells is a little leaky. And then when the cells give off material to go back into the blood vessels, well, it's a little leaky. And it's the lymph that picks up the leak and transports that material to get out of the body. And so the gut-associated lymph tissue includes the tonsil, the sinuses, the adenoids, and the tonsils. And so if you have inflammation in the adenoids, sinuses, and tonsils, you have inflammation in 24 feet of lymph tissue. Which is why when kids get a sore throat, what's the other complaint they almost always have? Stomachache. Because the tonsils are part of the in kids, it's 26 feet. As we become adults, it's 24 feet. But the kids get sick in the stomach and in the throat because it's all one system. Mm-hmm. And so we think we're brave that we can just go in there and get out what's on the tonsils without understanding that what's on the tonsils is on 24 feet of lymph tissue. And its responsibility is to clear out the wastes, toxins, impurities, and inflammation that overwhelmed the intestinal system in the body. And that the lymph tissue, which is why you produce more mucus, because mucus is responsible for extravasating the toxins and delivering it out with the overgrowth of the bacteria that gets it out as well. So if bacteria and mucus are responsible for helping the body rid itself of waste, toxins, impurities, and inflammation, then when they overgrow, they're just doing an increased, augmented job of what they ordinarily do. And so the job is not to suppress it. The job is to support it. And so if you keep getting sore throats, it's not because you lack antibiotics. And it's not because you keep catching microorganisms. No. If you keep getting a sore throat or enlarged adenoids or congested sinuses, it's because your body is continuously trying to rid itself of increased wastes, toxins, impurities, and inflammation that you're not paying attention to, that are predominantly coming from your diet.